start the hour by taking you here live. Africa CDC, this morning gave its weekly press briefing on COVID-19 response activities on the continent. Let's take you there.
And also utilize the question and answer section on this Zoom platform. Please note that today we are ending our press briefing at 11:45. So please be very ready with your questions as soon as Dr. John finishes with his briefing, so that we can take as many of them as possible before we have to adjourn at in 45 minutes time. All right, let me now bring in Dr. John, who is our usual host, and he's on standby. Dr. John, good morning, and you have the floor.
Good morning, Wayne, and colleagues and media. Very warm greetings from Addis Ababa, from the Africa Centers for Disease Control and Prevention. Thank you all for honoring our weekly press briefing. Today, as in previous weeks, I'll do three things: look at the epidemiological situation, evolution of the situation on our continent. And then second, look at what Africa's CDC continues to do to support member states, and then conclude with the vaccine and vaccination efforts across the continent. So let me start with the epidemiological situation. As of today, over 4.3 million COVID cases have been reported across all 55 member states. This accounts for 3.3% of all total cases globally. The total number of recovery stands at 3.8 million. That represents 90% of the overall infection, that is, of everyone who has been infected on the continent. Unfortunately, 114,000 deaths have been recorded across all 55 member states, and that represents a case fatality ratio of 2.7%. The global case fatality ratio continues to be stabilized at 2.2%. So our 2.7% is by a few points higher than the global average. In terms of the variants, the numbers have not shifted a lot. 19 countries are reporting the presence of the B117 variant. And another 18 countries are reporting the presence of the B1351 variant. So we see that these numbers continue to increase as expected. As the virus mutates and people move around, we expect to see these variants continue to spread. With respect to the changes of the trends over the last 1 week, the week 13, which is this week, if we compare this week with 12, we see the following trends. One is that 80,000 new cases have been reported across the continent, and this represents a 4% increase in the total number of cases compared to last week. The highest proportion of new cases came from East Africa, and that is about 37% of the new cases. And if you look at the other regions, we see the following breakdown. Northern Africa witnessed a 32% new cases, Southern Africa 15%, West Africa 9%, and Central Africa 7%. The following 5 countries reported the highest number of new cases last week: Ethiopia 14,000, Tunisia 10,000, Kenya 8,700, South Africa 6,500, and Libya 5,800. In terms of deaths, if you compare last week and this week, we recorded about 1,900 new deaths across the continent, and this represents a 2% decrease compared to the previous week. So as usual, let's also look at the trends over the last 4 weeks. The following trends were observed, that is between March 8th and April 4th. In terms of new cases, there's been an overall 4% average increase in new cases across the continent in the 4 weeks. The following are the breakdown by regions. East Africa, 22% increase, 10% increase in Northern Africa, 6% increase in Central Africa, 10% decrease in Southern Africa, and 12% decrease in Western Africa. So if we now look at the breakdown by the most populous countries on the continent, Kenya, we've observed a 36% average increase, Ethiopia 20% average increase, Egypt 5% average increase, and decreases in 3 countries, South Africa 4% decrease, DRC 14% average decrease, and Nigeria 31% average decrease. In terms of deaths over the last 4 weeks, we've observed a 2% average decrease in new deaths across the continent. Let me now transition to the testing and the capacity building efforts. So as a continent, we have conducted a cumulative total number of cases across the continent at 41 million. So 41 million tests have been conducted since the pandemic started. If you compare last week's number of tests and this week, there was an increase of 2.5%. The case positivity rate is around 10.5%, and the test per case ratio is exactly at 10. So 10 is that threshold where the WHO is recommending for appropriate testing. Nearly 8,500 people were trained on the use of the antigen test. These are the rapid tests that are similar to the polymerase chain reaction, the molecular tests that are gold standard for COVID-19 testing in 17 countries over the last week. And we continue to commit ourselves in supporting countries to roll out these rapid tests, because they will be extremely valuable in detecting the virus and conducting further screenings. In addition to that, the Africa CDC shipped out 200,000 PCR extraction, that is the molecular test reagents, to 10 member states across the continent, including Congo, DRC, Zimbabwe, Malawi, Sudan, Chad, Central African Republic, Guinea, Sierra Leone, and South Sudan. With regards to medical supplies, as we said earlier, our strategy is to continue to focus on the case management. So we are especially supplies of oxygen. So in that effort, we have shipped out the following to Sudan: 16 oxygen concentrators, 8 mechanical ventilators were also shipped, 12 oxygen concentrators to Zimbabwe, 17 oxygen concentrators and 7 mechanical ventilators to Malawi, and 62 oxygen concentrators to the Democratic Republic of Congo. So all of that is in recognition of the need that hospitalized patients are in need of just basic oxygen supplies. We continue to train member states and build their capacity in partnership with Project Hope and the Brown University for healthcare workers' capacity to vaccinate. And a total of 554 healthcare workers were trained by Africa CDC last week, and that represents an increase of over 10%. Our goal is to scale this up progressively as we move on. So let me now conclude by focusing on the vaccine updates. A total of 33.8 million vaccine doses have been acquired by member states, with approximately 12.9 million doses administered. And as of today, 31 member states have received their consignment of COVID vaccines from the COVAX facility, resulting in a total of over 16 million vaccines or doses received so far. So let me then share some good news across the continent with you. 2 countries, Seychelles and Mauritius, have received enough COVAX vaccine doses to reach 20% target vaccination benchmark, which was what the COVAX facility promised. So I think every little step and progress that we observe in the continent is good progress. So it's always good to highlight those success stories. Seychelles, for example, has vaccinated 64% of its population, with nearly 38% fully vaccinated with 2 doses. I think that is important, very good progress. So Seychelles is receiving vaccines from the COVAX, but also receiving vaccines from their bilateral arrangements. Morocco is recognized as having administered over 4 million doses of the COVID-19 vaccines, which is the most doses on the continent to date, with nearly 11% fully vaccinated with the second doses. So let me conclude by just focusing on the AstraZeneca situation that we all are learning and as we move forward. Recently, this week, the European Medicine Agency Safety Committee, in abbreviation PRAC, indicated that unusual blood clots with low blood platelets should be listed as a very rare side effect of AstraZeneca vaccine. I think that is the first time that the European Medicine Agency is indicating that. However, the recommendation still stand that the benefits of receiving the vaccine outweighs the risk of this unusual and rare side effects of the vaccine. The UK Joint Committee on Vaccination and Immunization also have issued some guidelines that are worth mentioning here. So that one, the benefit of prompt vaccination with AstraZeneca vaccine far outweighs the risk of adverse effects for individuals 30 years of age and over, and those who have underlying health conditions which put them at higher risk of severe COVID diseases. They further add that adult age less than 30 years without underlying health conditions that put them at higher risk of severe COVID disease should be offered an alternative COVID-19 vaccine if available. So I think that concludes our briefing on the COVID situation as we saw it this week. I will now return it to Wayne for you to manage the question and answer sessions.
Yes, thank you very much, John. And the first question is directly related to your the last part of your briefing, and it is coming from Maggie Fick, and she is with Reuters. So she says, what is your reaction to the European and British health regulators' announcement yesterday that they have found possible links between the AstraZeneca vaccine and rare cases of brain clots? I think that there she wants you to tell us whether you are still recommending that Africa should use AstraZeneca. And then she goes on to say, are you concerned, given that AstraZeneca makes up the vast majority of doses that African nations expect to receive through COVAX? So that's from Maggie Fick of Reuters.
So, very good question. I think there are two parts to that question. So the first part is, what do we make from these recommendations from the UK and from the European Medicine Agency? One thing should be very clear. When you roll out vaccines, especially new vaccines, you back that up by a surveillance program, which is you're looking at all possible side effects in all transparency. And if you have good systems, you pick signals, and that is what is happening. So I think it speaks to good systems that are in place to pick those rare signals. The key word here is the rareness of these occurrences there. The other thing to note is the transparency of the communication, both from the UK side and the European Medicine Agency, that they are rare and they are taking precautionary measures. But the overarching message, both from the UK and the European Medicine Agency, is clear. The benefits outweighs the risk, because these are very, very rare occurrences that they are picking up due to a very strong surveillance systems that they have put in place. So I think these vaccines continue to be safe. We would still recommend that the vaccines be used. in this situation and circumstances. With respect to concerns for the continent, remember that we and others, including the World Health Organization, regional office in Brazzaville, have also put in place a system to continue to monitor the side effects and rare occurrences of any other events across Africa. So again, let's credit what the European Medicine Agency have done, because by having those strong and enhanced systems, it enabled them to pick a very rare event. I think that should be interpreted in the positive light.
All right, thank you. We go to our WhatsApp platform and we have 2 questions that are coming from Sophie Mukwena. And Sophie is the foreign editor at the South African Broadcasting Corporation. So she says, we have recently experienced pockets of conflict in Africa. For example, in Cabo Delgado in Mozambique and in Tigray in Ethiopia. What impact does this challenge have in the fight against COVID-19 and the access to vaccines? So that's the first part of her question. She has a second one, and she says, when is South Africa going to receive its vaccine consignment? And what is the Africa CDC's position on the proposed vaccine passport? That's from Sophie Mukwena.
Yeah, thank you, Sophie, for the three excellent questions. So the basic principles of fighting a pandemic or an outbreak is that conflicts do not bode well with the ability to fight a disease. I mean, that is simple stated. So in any area of Africa, countries or region that we experiences conflicts, it will delay the fight against the COVID-19, be it in the ability to roll out vaccines or impose or actually implement basic public health measures. So conflicts are really detrimental to any efforts to fight the pandemic or outbreaks. We saw this in DRC, in North Kivu, where it took us more than 2 years to beat back the Ebola outbreak, even though we had all the good tools in the field. I mean, we had good monoclonal antibodies. We had 2 vaccines that could be used for ring vaccination, but yet because of the conflict there, it took almost 2 years to defeat that Ebola outbreak. So that is really not good for the ability to rapidly eliminate or fight a pandemic. With respect to South Africa, South Africa has also received vaccines from will also receive vaccines from the COVAX facility, as well as their own initiative, which is the bilateral deals, which I'm not in a position to, I'm not privileged to that information to be able to share with accuracy when South Africa will receive the other doses of vaccines. I think the national program, I think the minister is part of the African Vaccine Acquisition Task Team, should be in a good position to explain that to you. Your third question on the passport is our position is very simple, that any imposition of a vaccination passport will create huge inequities and will further exacerbate them, because we already are in a situation where we don't have vaccines, and it will be extremely unfortunate that countries impose travel requirement of vaccine immunization certificates, whereas the rest of the world has not had the chance to have access to vaccines. It's not because the continent doesn't want to be vaccinated, they just don't have the vaccines. It's not because the continent doesn't have the resources to get to vaccines. There are countries that have the money to get vaccines, but there are no vaccines to be acquired. So if we go ahead and impose travel requirements or travel immunization passports, then we further makes the situation extremely complicated, and that further exacerbates the inequities that we are all trying to fight against. So our position is clear that we cannot at this point impose it would be inappropriate to impose vaccination passports or requirements given where we are in the rollout of vaccination across the continent.
Thank you very much, John. And I hope that Paul Adepoju was listening there, because he also had a question on the vaccine passports. Now let's go online and take a question from Girum Chala. Good morning, Girum.
Good morning, Madam Wayne.
Morning, Girum. Please go ahead with your question.
Thank you so much. Thank you so much, Dr. John. My question is about...
We're dipping out of that Africa Centers for Disease Control and Prevention update and taking you live to this now, the special provincial funeral for KwaZulu-Natal's first premier. Dr. Frank Mdlalose is currently underway at the Madadeni in Newcastle. Various leaders have paid tribute to the 89-year-old who died of COVID-19 related complications on Sunday. Let's take you there live.